Healthcare in senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Hello, and welcome to another edition of Senior Care Confidential. I'm joined again with my lovely co-host, Joe Alch.
Hello there.
And today we are guestless, and we figured we do a lot of studies and we read a lot. And so we've come across some recent studies that I think are interesting for the audience to hear. There's a lot of times where we're sharing things on why we do certain things, but sometimes the studies or the stats don't seem to hit. And so we figured we would give some additional ones today that may make it sing to family members and to seniors. And so one of the ones that we will get started with is this Pittsburgh fatigability study. And so, you know, guys, if you've listened to any of the podcasts here, you know I'm big on the fitness part and the movement science, all that kind of stuff. And obviously, as a physical therapist, it's kind of my thing. But what's interesting is we've looked at a bunch of different fatigability tests or frailty indexes and those kind of things. And so I'm always fascinated by these because they all have a slightly different flavor than the other ones do. And so what I like about this one is it incorporates a lot of like normal activities, things like light housekeeping or even like social settings, like being able to sit for an hour with family members or watching television for 2 hours. Like 10 of these things that kind of, they actually exist in most of our daily lives. And so what the University of Pittsburgh did is they put together this fatigability index, and they studied some older adults over the course of 2.5 years. And they found that there was a certain score, the score is 25, but it's a scale of 0 to 5, 0 being, I think 0 is being no fatigue, 5 being completely exhausted. And so if you are above a 25, so out of 10 of these, you know, if you're scoring in the 2.5 or whatever higher, you're above a 25, you're twice as likely to die in a 2.5 year period, more than twice as likely to die in a 2.5 year period versus those who score higher or lower.
Well, you know, it's funny. Both of my grandmothers, one lived in 98, one lived in 97, both worked in their yard, you know, cut the grass, both trimmed the hedges. One of my grandmothers used to get on a ladder at 97 and she would clean out the gutters. And finally a neighbor's physician was driving down the street and saw her. As a little town in South Carolina. You are getting off that ladder
put the kibosh
right now.
On the ladder, yeah.
I know. But, you know, you think about it. You just think about, you know, we talked about last week about healthy longevity and living longer. And these people that live longer are still enjoying life.
Yes.
You know?
Yeah, there's something about and I think a lot of it's like the variety of things too. I think we brought up it last week about the study about, you know, I like to rely on this one because in my world as therapy, we know that with age-related muscle loss, like when you start to see that advance quicker, we see a lot of the side effects of that and the bad effects like falls and fractures and those kind of things. And so I'm big on making sure we've got patients up moving or seniors up moving more to help avoid some of that stuff. And so there was that study about takes 5 months to gain 2.5 pounds of muscle mass versus in 10 days of being bedbound, you can lose the equivalent amount. And so what I liked about this one is because it's so functional. It's like all the stuff that we would normally do. And so I like this one. And the authors of the study describe fatigue as something that's different from just being sleepy. This is, you know, and this is one of the things that I run into with a lot of our older patients. I have a couple right now that, you know, I still treat some patients, you know. Most of my day I spent, you know, in sales marketing or doing some trainings or whatever, this show, but I still like the work. So I still treat a few patients on the side. But there's actually my main gig. I really like it. But
too. I love those sweet little seniors.
Yeah. So I can't get rid of them. Yeah. So I love it. So anyway, I have a couple of these patients that I work with, and a couple of them are really dealing with some really heavy fatigue. And it's interesting that, you know, if you think about how we interpret fatigue as younger people. It's like, man, I'm really tired. It's probably because we did too much yesterday or whatever. And so our natural inclination is to rest more, right? It's like, I'm so tired. If I just give my body some sufficient rest, I'm going to bounce right back and I'll feel so much better. And what's interesting is as we get older, it's almost like that signal is flawed, where now the fatigue, like this study shows, that fatigue level is not because you're lacking rest. It's because you're not moving enough. It's actually the opposite. So the fix is the opposite. So I don't know if we talked about this on this podcast before. We talk about mitochondrial health.
A little bit.
Okay, so there's this, without getting too much in the details, if we talked about it before, you guys can go back and look at it, or just go look up zone 2 exercise. And essentially what zone 2 exercise is, it's a zone of your heart rate. So you have the max heart rate. Zone 2 is kind of like, I'm exercising enough where I'm slightly out of breath, but I can still hold a conversation. That's kind of that range. So you don't really have to break out and check your heart rate. Just be slightly out of breath as you're talking. And so what they found is if you operate in that zone, not like high intensity stuff, just in that zone, it actually increases what they call mitochondrial health in actually number. And mitochondria are the powerhouses of your cells. And so the fact that we have these older people who are not, they just lack complete energy. All they want to do is nap. All they want to do is sit on the couch. And even when they're sitting on the couch, they're falling asleep, right? And so they just think they've gotten this mode of, I remember when I was younger, if I just got some rest, I would feel better. And unfortunately, they're feeding into that negative feedback loop of now because you're resting too much, your mitochondrial health is diminishing, your overall energy level is diminishing. And so this is where I think something like the Pittsburgh Fatigability Index could be something that's really useful in utilizing with our own patients. In fact, I sent it to my therapist earlier this week to say, hey, here's another option we can look at as we're starting to talk through some of these things with our patients.
Well, and about 10 years ago, I heard Dr. Alexander Peralta, who's very well known in the palliative world, but he singled me out in a crowd of like 200 and he said, Joe, never retire. He just talked about how important it is to stay active. My granddad, I said my grandmother used to trim the bushes and run the lawnmower. My granddad turned 65 and turned on the soap operas, and that is all he did all day.
Yep.
Took a break for lunch, wouldn't go on vacations. He was obsessed with soap operas, and he declined so quickly.
Yep. There's something about I don't know if it's spiritual. I don't know if it's just wiring in our brains, but there's something about having a future that's bigger that you look forward to.
Yeah, it's goals.
That drives the body and the spirit to continue to go. Mm-hmm. And it's almost like once you get to that point where you retire and you kind of retire from goals or retire from life and you sit on the couch and you watch soap operas or whatever, it's almost like you've told the universe, I'm done with these body parts now, you can take them back. Mm-hmm. And so there's something to like having some additional things that you're working on, like, some hobbies or, anything, social interactions, travel, all those things. There's a number of different things. I'm a big fan of having things that are value contributing, like to society, whether you're volunteering or you're mentoring up and coming engineers. If you were a former engineer, like something where you feel like I'm contributing it again in a bigger fashion. I think that stuff helps.
Even singing in the choir.
Yeah.
I sing in the choir. I love it so much. They're all ages. I'm certainly not the youngest, but I'm not the oldest either. Yeah. And we just love one another and sing. And it's so, when we're singing as a choir, I just feel like we're walking on water. It's just amazing.
Yeah.
And so,
and it fuels you.
And I look forward to it.
Yeah.
So let's talk about that 75-year-old that maybe broke a hip, they're post-op 2 months, and where do I go from here? So Brian, what would you tell them?
So assuming they've already gone through rehab?
Gone through rehab.
So they've kind of been discharged from the healthcare system. They're living on their own. I would be very keen on making sure that you're engaging in things that are, in fact, one of the things that we do is before we're discharging, we want to make sure that you've got activities weekly, multiple times a week, that are social, mental, and physical, because we just know, like, this is how our bodies and our spirits and our minds have been designed, that you need to have at least those three things going for you, or we already know that there's going to be a decline. And so,
and for those listening who have a parent that is in an assisted living, look at those activities too. I strongly encourage my clients that are living in communities to get involved in those activities. They're not only fun, but you make friends.
Yes.
And so many are terrified to do that. I don't know why. I would be downstairs. I'd be so excited to put a flower arrangement together.
I'm so keen on those, like you, in some senior living communities where I find out that these are new residents. I'm like, hey, so have you made friends yet? And they're like, no, I'm just not, and I could tell that there is some hesitation in getting involved in some of these activities, but I already know by the time I discharge, this person better be in those things, or I'm going to be seeing her again in 6 months. And so on one or multiple of our visits, I'm introducing her to usually the mayor. There's all these communities have a mayor. It's the little old lady who knows everybody in the community, and I want to get them introduced so that there's somebody kind of prodding them to get involved in these things.
Well, and some communities too, which I think is a great idea, have a buddy program.
Yeah.
So if there's somebody new in the community, they're assigned to a buddy, and the buddy introduces them and lets them know where to go and what to do. And I've talked to you, Brian, about. I remember a few years ago going to a community with a hospice patient, and there was a walking club, and it was a physical therapist, OT, it was caregivers, it was family members, and they all had the same T-shirt on, and there they go. And the physical therapist is like the Pied Piper right in front.
Yep.
I loved it. And those people had the biggest smiles on their faces, and just, they couldn't wait.
Yep.
They couldn't wait. So any ideas that even our seniors living at home on their own, get involved with your homeowners association, put together a walking club. If you're an adult child, call the homeowners association of your parents' neighborhood and say, what are there activities that my dad could do?
And there's senior centers in every city around here.
There are.
Frisco's got one, McKinney's got one, I think Allen's got one, Dallas clearly has one. Like there's plenty of activities to get people involved with. And I think that's the thing, is you need to have things that you're looking forward to on a weekly basis that incorporate all those factors, mental, social, and physical. And then that obviously is going to help with that particular.
Well, and I have a friend, and it helps with mental health too, but I have a friend who lost her husband, and she's about 77. She took a pickleball class, and I took one with her. It was a blast. And so I guess her husband passed away a year ago, and she just went to San Diego by herself for a pickleball training camp.
That's
and
awesome.
I know, it's so amazing. So there's stuff out there. There is so much. So get in touch with, what do you like to do? And go for it.
That's right.
Right.
All right. So the next study was an interesting one. And this one was, I was kind of surprised, because I feel like in our world, we see this happening more frequently, where we're testing and screening for these things, but apparently it's not happening according to the study. It says 8 in 10 seniors have not had a cognition screen, which is wild to me.
It is not wild to me at all.
It's not. Okay.
It is not wild, because you're seeing people that come out of the hospital, they've seen their doctor.
Yeah.
I see a lot, with private duty, that just don't go to the hospital, or, they don't want to know that they've got dementia.
They say as much as 50% of seniors with Alzheimer's is undiagnosed, which again, there was another one in the same study that was like, wow, that's a shockingly high number.
And there was a couple I met with today. I mean, I don't know how in the world they are living alone. I got a call from a neighbor and went and met with them. And so the first thing is, have you seen a neurologist?
Yep.
Oh, no, I haven't. I said, okay, we're going to make an appointment. Well, I called a neurology group, and one of them was on their roster. So they said, we had this person on our roster, but I don't think he ever came in. So, so maybe he was afraid. People don't want to know the inevitable.
I kind of thought that too. So when I saw this study, I was like, okay, so maybe it's that they're not asking for it. Maybe they're because I try to put myself in the shoes of somebody who's starting to lose their memory, and I would think that I would probably want to mask that as much as I could too. And so, but the study showed that, what was the number? It was the vast majority, like 96%, said a memory test that showed signs of trouble would cause them to take action to protect their brain. And 75% they would adjust their health care to accommodate for that. And so it sounds like the vast majority of people kind of want to know, while they may not want to know, they really want to know, because they would obviously make some changes. So why do you think people are not getting the testing?
I think they're scared to hear that they've got Alzheimer's. They see what Alzheimer's and dementia, it's a long, slow process. I mean, I don't know, it's kind of like getting a body scan and finding out if you've got cancer.
Yeah, but I think even with Alzheimer's, like those things, if you can catch them early enough,
I know.
they're easier
it
to
can help
fix.
You slow.
Fix,
no,
but slow.
You can't.
Yeah.
You can slow. Some of the cancers you can fix, but people aren't getting in line to get a body scan.
I have one.
Oh, you did have
I'm getting one done.
I'm going to get one too.
Well, we've had some. There's been some friends of ours who've recently passed, heart attacks and those kind of things. And so it was just one of those things where, okay, I'm getting in my mid to late 40s now. And so why don't we just go check and make sure there's nothing brewing? And so, I'll be doing the full body scan. I've done the heart stuff already, but I also know, like, the faster I get to stuff, if something's brewing, I want to know now so I can fix it before it becomes an issue later.
But a lot of times with confusion, short-term memory, a lot of us, myself, I have way too much going on, and I'm super ADD, and so I get distracted very easily. But I should take the test too.
Yeah.
I'm 60. I probably should take the test too.
Look for some plaques. Yeah, that's right.
Yeah.
All right. The last thing I want to talk about. So this one, I can't believe this. So there was an article that was just posted, and you see a lot of you have a different perspective than I do. And so I'll boil it down. The too long didn't read is Medicare is now they're wanting to pay for caregiver training. So when I read that, it's like, okay, great. They recognize the need for caregiver training. Now, I obviously work in the home health space, and so in my world, it's like all of our caregivers and all of our family members get trained by our nurses and our therapists, because we're looking at, like, the long-term trajectory of this patient. It's not good enough to solve for the things that are presently in front of us. The 6 to 8 weeks that we're out there with a patient, whatever it is, following a medical complication or a hip fracture or whatever. It's fine to help them get past that, but I want to make sure that we're looking 18 to 24 months in the future. What are the things that we need to do to help optimize the home? What equipment do we need brought in? What kind of caregiver training? So we are always focusing on caregiver training, but apparently the caregiver training is not happening to the extent that where now Medicare is going to start looking at reimbursing professionals like me for doing caregiver training. What am I missing?
I think that's awesome. I know, there are private duty agencies. I know in the state of Texas, private duty has to provide 12 hours of education. Unfortunately, with busyness and just trying to get shifts filled, they're giving them a sheet of paper and having them take a quick 10-question test.
Oh, gotcha.
And so,
but that's on the license side. This is, I think, talking about like family caregivers, because they're trying to address like the unpaid caregiver part of it. And so in the story, it talks about all these different, there's several different highlighted family members that they're talking about. And they're like, they're so frustrated because they come home from a hospital and they've got medication issues, or they've got, mobility issues. They specifically talked about ADLs, activities of daily living. Like, I'm not sure how to go about dressing, or how to go about rolling my dad in bed, or how to go about getting him in the shower. They talked about wound care stuff. And I'm going, if they were on home health, that piece should have been handled by the nurse and the therapist in the home. But it sounds like there's a lot of cases where home health's either not involved, or they are involved but not doing the caregiver training, to a point where it's happening in such big amounts that now Medicare is looking at, okay, we're gonna carve out this new program. We're gonna start paying for caregiver training.
Well, and this is what we talked about, before, that when I had my home health agency, I always wanted the physical therapist to be there and work with the caregiver, with our caregivers, so that they would know what to do.
Totally.
But I have a patient right now. I mean, she is a 2-person assist. She is too weak to stand on her own, but she wants to go and she wants to get in the shower. She wants to sit at her desk. She wants to go around the house, but she cannot move. She is just dead weight. And so the caregiver said, well, can we get a Hoyer lift? Well, we can get a Hoyer lift, but who is going to train that caregiver to do that Hoyer?
Right.
So, not everybody, and there are different types of Hoyers. And so, there is a lot, there's such a need for that training.
They have a quote from the president and CEO of the National Alliance for Caregiving. He says, "We know from our research that nearly 6 in 10 caregivers assist with medical and nursing tasks, such as injections, tube feedings, and changing catheters," which is also interesting that we've got private people changing catheter changes. I would be having nurses out there doing it. But anyway, but fewer than 30%.
Not everybody can afford a nurse.
through Medicare
Even
and
through
Medicare Advantage.
Medicare, no. Some, like we have a patient right now, the family's having to pay privately for us to change their catheter once a month.
Is that right?
Yeah, they cannot get a home health to do it.
I wonder if they can't find one that's in network.
Could
Anyway,
be.
so, but they say 30% of caregivers have conversations, only 30% of caregivers have conversations with health professionals about how to help loved ones, which again is fascinating to me because if they're having these kind of issues, they've had to have come from, skilled nursing facilities, hospitals, rehab hospitals, and a lot of them even with home health. And they're saying only 30% have actually had conversations with healthcare professionals about how to manage mom or dad or whoever
Okay,
at home.
but then, those people that are doing 24-hour a day care and they've got that 30-minute window while the physical therapist is there, they may go take a shower.
Yeah.
They may go take a quick nap. So there's really
You're right. And you're right. We do see that too. Cause it's like, hey, when you guys come in, cause I need like a 30, 45
yeah, or I
minute
need to
break.
run to the grocery.
Totally get it. Yeah.
So, I agree that Medicare should set an allotted time just to come in and do teaching.
They do. I think you could do a lot more with through home health. Because here's the challenge with caregiver training, is depending on how they set this thing up. If it's just like a one-off thing or even a couple visits, I will tell you when I'm working in your lady with the Hoyer, right? It would probably take me a few to several visits to figure out precisely how to make it easy for the caregivers, right? Because we're going to look at directions that we transfer. We're going to look at different types of equipment. We're going to look at what type of bed she's in, all these things, and then practice them myself with the patient to figure out, okay, is this going to work? Is this not going to work? And so it would take me a few visits to kind of figure out how to make that easier for the caregivers, and then to transfer that education, that learning to the caregivers, probably like another couple visits. So I think it really depends on how Medicare is going to do this. But right now, I'll tell you, if you do it through home health, they should be spending a couple visits with you learning that stuff. Yeah.
I think it's the simple stuff.
Yeah.
I think, we live in a United Nations. We're a melting pot here, and not everybody knows, how to use the right equipment, the right products.
What equipment's available?
They can't read the prescription. I had a family, I was teaching their private housekeeper how to apply cream. She couldn't read the instructions because she didn't read English.
Oh, wow.
So, you have to ask questions, and that, and you can't assume.
Yes.
So I think this is so important.
Yeah.
It's so important just because people are living longer, and
So bottom line, caregiver training is important.
Very
Whether
important.
or not Medicare is going to cover it, they currently do through home health, but apparently they're going to cover this through a different means.
And home care,
and private duty. Yep.
And if you're using a private duty agency, ask questions. Ask what that training is that they're providing for their staff.
Totally.
And if there's something that needs to be addressed to their staff, the private duty agency, the PAS, can add that.
Yeah. And going along with the caregiver thing too, we find oftentimes, back to our initial conversation about the Pittsburgh fatigability study, if we can educate the caregivers on the importance of those key aspects, like you can actually improve the overall quality of life of somebody through the caregiver who can encourage those mental, social, and physical type things.
Absolutely.
Yeah.
Absolutely. Thank you. This was great conversation, Brian.
Thanks, Joe.
Yeah.
Great to see you.
Thank you.
We'll see you
Next
time.
week, we are going to be talking about the new COVID variant. And we have somebody coming in, and how do you protect yourself?
There you go. Thanks, Joe.
Thanks so much.
Bye.